Hi, my name is Kodi Shirley, and today I'd like to talk a little bit about osteomyelitis. Osteomyelitis is an inflammatory condition of the bone caused by an infectious agent. Pyogenic or pus-producing bacteria cause the majority of infections. Staphylococcus aureus is the most common infectious agent and produces 90% of cases in infants and children. The vertebrae and long bones of the arms and legs are the most common sites of osteomyelitis. Vertebral osteomyelitis is the most common form of osteomyelitis. How does osteomyelitis affect the body? Osteomyelitis can be acquired from either exogenous or homogeneous sources. Homogeneous osteomyelitis results from a pre-existing infection spreading in the blood and then to the bone. An example of this would be a urinary tract infection causing vertebral osteomyelitis. Exogenous osteomyelitis is an infection that penetrates from outside the body into the bone. An example of this would be a compound fracture or a deep puncture wound. Implanted orthopedic devices and surgeries are also other examples of exogenous osteomyelitis. How osteomyelitis affects the bone. Once an infection is in the body, whether homogeneous or exogenous in origin, it can affect any bone in the body. Once an infection comes in contact with bone, the area becomes inflamed, pus fills the bone, and until it is forced out in eversion canals where it proliferates. An abscess is formed and the bone is denied adequate blood supply. Inadequate blood supply could lead to necrosis of the bone. Acute, subacute, and chronic are three categories of osteomyelitis based on the time of disease onset. Acute osteomyelitis is a new infection which is less than 2 weeks old in the bone that is a rapidly destructive pyogenic infection. This occurs more in children and older adults above 50 years old. Symptoms include an abrupt fever, lethargy or irritability, pus, pain in the area of infection, swelling, and redness over the infected area. If the acute phase passes without complete elimination of infection, subacute or chronic osteomyelitis can become apparent. Subacute and chronic osteomyelitis are very similar. Both are persistent infections lasting about 1 to 2 months for subacute, and chronic lasts over 3 months. Both have the same symptoms of persistent infection, chronic fatigue, swelling, and redness of the infected area. Pain or tenderness in the affected area and fever are also part of subacute and chronic osteomyelitis. Subacute and chronic forms of osteomyelitis usually occur in adults and people with implants. Risk factors for osteomyelitis. Any immunocompromised person, such as someone with AIDS, has an increased risk of acquiring osteomyelitis. Conditions that alter the vascularity of bones, such as radiation, malignancy, osteoporosis, are also have an increased risk for acquiring osteomyelitis. Systemic diseases like diabetes, anemia, and malnutrition that cause accompanying alteration in host events once again give an increased risk factor for acquiring osteomyelitis. Male children are at the highest risk for homogeneous osteomyelitis, and adults have the highest risk for acquiring chronic osteomyelitis. Osteomyelitis therapy requires early diagnosis. Identifying the causative organism through blood, tissue, or pus specimens help decide what type of bacteria is causing the infection and what medications are appropriate. Bone cultures and radiographs are common diagnostic tools, along with bone biopsies and needle aspirations that help in diagnosing osteomyelitis. In difficult cases, radioscopy, bone scanning, and magnetic reconnaissance imaging, or MRI, are used. Treatment of osteomyelitis. In general, antibacterials and surgical interventions are always considered to be a okay treatment for osteomyelitis. In certain cases, mainly exogenous osteomyelitis, surgical treatments such as debridement of necrotic bone and tissue, obtaining appropriate cultures, and managing dead space are used to treat osteomyelitis. Surgical debridement is not necessarily involved with the diagnosis or treating of homogeneous osteomyelitis if it's made early. If antibiotic therapy fails, then debridement is the next step. In cases involving a prosthetic joint infection, intravenously administered antibiotics in addition to surgical removal of the prosthesis is the best treatment. The joint is left out for about 2 to 6 weeks, and a course of antibiotics is ran, and then another joint is then implanted. The prognosis of osteomyelitis, if caught early, is very good. If not detected early and chronic osteomyelitis develops, then the outcome becomes worse. The longer the infection inhibits blood flow to the bone, the more likely for fractures and tremendous bone loss. Amputation and death are consequences of a severe chronic infection. Impairments and functional limitations caused by osteomyelitis. The main impairments of this disease are, of course, bone fractures. This could lead to a decrease in range of motion and also lead to immobilization of the infected joint and muscle atrophy. Functional limitations would be the inability to perform bed mobility, inability to perform transfers, and inability to perform gait. All are due to pain and muscle atrophy. Physical therapy can help someone with osteomyelitis. The first thing would be to make sure that during physical therapy interventions that we do not harm the patient, as in causing a bone fracture. Wound care and prevention of further infection would be the next step in rehabilitating someone with osteomyelitis. Debridement and sterilization of the wound are important, especially in chronic osteomyelitis. Pain and muscle atrophy are symptoms that physical therapy could address and would be indications for therapy. A precaution of physical therapy would be not to cause any more bone fractures, and would be to make sure that the infection does not spread. Physical therapy contraindication would be anything that spreads the infection, such as a hot pack. This is a picture of a bone scan that shows the abscess in the bone in the tibia of the leg. If you notice what the arrows are, the circular area is darker, and you can tell that the abscess is forming on the tibia. This picture is of an acute osteomyelitis symptom. You can see that the pain and the redness is there, and is severe swelling. Okay? So I'd like to thank you today for watching my presentation.